Assalamu alaikum wa rahmatullah. Our article for this week is a clinical trial titled Platelet-Rich Fibrin and MTA in the Treatment of Teeth with Open APCs. It was done by Pham et al. In 2024. The aim of this study is to evaluate the effectiveness of using platelet-rich fibrin as the apical matrix for the placement of MTA in non-surgical endodontic therapy for teeth with periapical lesions and open APCs. Materials and methods: 12 teeth from 11 patients with periapical periodontitis and open APCs were enrolled in this study. Non-surgical endodontic therapy was performed with the platelet-rich fibrin used as an apical barrier and the MTA manipulated as an apical plug for the further thermoplasticized gutta-perca in the remaining part of the root canal. Clinical signs and periapical digital radiographs were recorded and analyzed to evaluate the curing progress after periodical follow-up of 1, 3, and 6 months. The horizontal dimension of the periapical lesion was determined and the changes in the dimensions were recorded each time. Moving on to the results. The horizontal dimensions of the periapical lesions on the radiographs were analyzed. There was a width of nearly 10 millimeters at the diagnostic stage, and the patient was completely cured after all at 6 months. The lesion width reached a small value at 3 months and nearly reached 0 at 6 months of follow-up, indicated that all lesions had progressed and cured during the investigated examinations. The results revealed that there were significant differences among the horizontal dimensions of periapical lesions on digital radiographs at the different investigated time points. The horizontal dimensions were successively reduced at each periodic radiographic measurement. This proves that the healing process has successively and firmly progressed. Another finding is that there was a significant differences among the 5 pairs of values at the examined periodic measurements. This result proves that the curing process has been continuously occurring in a positive direction with significant improvement occurring through every successive periodical examination. Also, there were significant differences in the width of the periapical lesions among the periods of periodic examinations. Another finding is that there was a significant difference in one pair of measurements between the 2 successive periodic examinations for each period of periodic examination. So the results demonstrated that the lesion dimensions decreased rapidly in the first month and then decreased at a slower rate in the last month. Between the 3 and 6 month periodic examinations, the mean difference in the reduction in lesion width was nearly 0, which indicated that there was no further room for reduction in lesion width. The differences and the decreases in the first period are greater than those in the last period, which means that the healing process is rapid in the first month. The first signs of continuing formation of root end were observed in the 2nd month after completion of the procedure. The continuing creation of the root end in the present study has proven that this non-surgical endodontic procedure is definitely the regenerative approach. So, in conclusion, platelet-rich fibrin is an effective barrier when combined with MTA for the treatment of the teeth with periapical periodontitis and open APCs.